Hello and welcome to a COVID-19 safety update, and where we'll focus on respirators and masks as well. In understanding how the COVID-19 transmits, we need to look at how it projects. Droplets larger than aerosols, when exhaled at a velocity of 3 feet per second, evaporate or fall to the ground less than 5 feet away. When expelled at a high velocity through coughing or sneezing, especially larger droplets greater than 0.1 millimeters, can be carried by the jet from 6 to 20 feet away. So coughing can shoot droplets like projectiles out of the mouth with a muzzle velocity of 164 feet per second for sneezing or 32 feet per second for coughing. And droplets can reach distances as far as 20 feet away. If so, then the much mentioned safe distance of 6 feet in social encounters may not suffice, except when you wear a respirator or even a simple mask. So when we look at this anatomy of airways where the droplets can end up, depending on their size and what droplets are blocked by what masks. If you look at the top of the image, you can see that cough sneeze droplets can reach beyond 2 meters or 6 feet. So the larger droplets can be blocked by a regular surgical mask. However, the smaller can be blocked efficiently by only an N95 or greater mask. So we look at these three typical types of masks. N95 masks have been shown to filter out upwards of 99% of particles, thus reducing the aerosol load by 100-fold. The surgical masks lower the number of aerosol droplets behind the mask, still by a substantial 4-fold compared to the outside of the mask, as if you weren't wearing a mask at all. Cloth masks can also reduce the chance of spread. However, there's much variability depending on the fabric type. So if we look at this image and we use a reference value of 100, the filtering effects for small droplets or aerosols by various masks, such as homemade or tea cloth or other cloths, surgical masks such as the 3M Tylon style, and an N95 respirator mask. The numbers are scaled to the reference of 100 source of droplets for this illustration here, and calculated from the protection factor values. So if you look at the left one that's protecting yourself, inward protection, the cloth, tea cloth, or homemade mask, particles leak through the mask when referenced at 100 or 33, surgical mask 25, and your greatest protection N95, it was 1. Now protecting others outward when referenced using a reference value of 100, the particles that leaked from a cloth, again a lot of variability, 90, surgical mask 50, and then the N95 was 30. So to better understand and look at how the SARS-CoV-2 virus, like any virus, it must dock into human cells using a key lock principle, in which the virus presents the key, and the cell, the lock, is that complementary to the key to enter the cell and replicate. For the SARS-CoV virus, the viral surface protein spike S is the key, and it must fit snugly into the lock protein, which can be found in the human cell. This is what you're trying to eliminate, that transmission. So the major route of viral entry is likely via large droplets that land in the nose, where that expression of that viral entry receptor is the highest. This is where it's the highest, through the nose. This is a simple transmission route that could be effectively blocked by already by simple masks that provide a physical barrier. So you can see at the top, there's larger droplets, most likely getting into that point infection in the upper respiratory. And it can be blocked, the larger ones can be blocked again by the surgical masks, and the smaller ones by the N95. So FNS has respirators and masks available at the warehouse. All respirators are extremely valuable and must be signed out in quantities that are truly needed. Please obtain only what you need through your project managers, who will confirm with the safety director as to the exact quantities to be distributed. Respirators are to be handled with extreme care and extend the use as much as reasonably possible. And N95s must be worn per the FNS respirator program. Use the N95 only if you've been medically cleared per the program. Be sure to use an N95 only when required during activities such as crystalline silica, drywall dust, demolition, etc., and other construction-related hazards. If you are not cleared to use an N95, please wear the surgical style mask per the company policy, and is outlined on the following slides. Surgical and cloth masks are not a replacement to adequately protect yourself against crystalline silica, drywall dust, demolition, and other typical construction hazards. Use these N95s and perform a self-fit each time per the instructions that you can find on this link. Video link on the use of a 3M flat fold N95, such as the 9211 Plus, can be found here at this link. When carpooling regarding masks and respirators, employees may voluntarily ride together in a company vehicle as long as all passengers, including the driver, wear a protective covering over their mouth and nose while in the vehicle. Surgical style masks and N95s are in short supply, so employees who voluntarily decide to ride together should verify with their manager that masks are available for carpooling situations. N95 respirators can only be worn if an employee has been medically cleared to wear an N95. It is important during this unprecedented time to please work to extend the use of the N95 by way of: do not handle the inside of the mask, you could contaminate yourself. Work to handle the mask by way of the straps only as much as possible. Wash your hands prior to donning, that means putting on, and doffing, taping off the mask. Once you remove the mask, lightly brush the outside of the mask. Do not use compressed air, as this can destroy the mask and spread the virus or other hazardous materials that you're working to protect yourself or others from. Spray the outside of the mask with a bleach water solution, which is 2/3 cup bleach to a gallon of water, or 70% or greater isopropyl alcohol or hydrogen peroxide. Then you can store the mask in a paper bag in a location that's between 4 degrees Fahrenheit and 86 degrees Fahrenheit. It is in a condition that's also less than 80% relative humidity, in an area that cannot be potentially, and stored in an area that cannot potentially contaminate or other surfaces at work or home. Allow the mask to completely dry between each use. We also at F&S have reusable elastomeric or silicone half masks with respirators. There's limited quantities available at the warehouse. Please obtain only what you need through your project managers, who will confirm with the safety director as to the exact quantities to be distributed. These are a good choice for repeated use. They're washable and can be used for long periods of time when used per the manufacturer's instructions, which can be found with the respirator and also this link here. You need to make sure they're specifically fitted to you, the employee, or the individual wearing them. They provide a high level of protection. These masks must be used in accordance with the F&S respirator program. Use them only if you've been medically cleared for the program and have been fitted for the F&S respirator program. Please contact your project manager to arrange to discuss this option, and then the PMs can arrange the supply and fitting, if required, with the safety director. Surgical style masks. There is a limited quantity arriving at F&S warehouse in the very near future, and there's even a more limited supply available right now. Please obtain only what you need through your project managers, who will confirm with the safety director as to the exact quantities to be distributed. These are for general use when a mask is required or requested by your worksite to help reduce the virus spread. It's wanted by an employee for volunteer use per the OSHA Appendix D, or you're voluntarily carpooling as outlined above. A limited supply is arriving, and they are designed for single use. However, during this pandemic, please be reasonable and practical to extend the use. Please treat these surgical style masks carefully and use the same care as you outlined in the N95 care instructions discussed above here. However, discard any mask if it becomes damaged or restricts breathing. Keeping in mind that person-to-person spread is thought to occur mainly via respiratory droplets produced when an infected person coughs or sneezes, we need to remain mindful that it is still thought it may be possible a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. So cover your coughs and sneezes with a tissue or elbow and throw that tissue in the trash. You want to create that barrier. You don't want to spread it by these projectiles in that high velocity. Avoid touching your eyes, nose, and mouth with unwashed hands. And then look for the symptoms of the COVID-19. Patients with COVID-19 had mild to severe respiratory illness with symptoms of fever, cough, and shortness of breath. Symptoms usually appear 2 to 14 days after exposure and can vary. They can include fever, cough, and shortness of breath. Avoid close contact with others who are sick. Practice proper social distancing. Limit in-person gatherings to 10 or less people. Keep a minimum of 6 feet distance between persons. Stay at home when you are sick and inform your supervisor immediately. Wear your eye protection at all times, and be sure to wash your hands prior to donning and after doffing your eye protection. It's very important anytime you're transferring PPE to and from yourself to make sure that you're properly washing your hands. Gloves should be worn at all times if the employee is unable to wash or sanitize their hands frequently. Wear gloves that apply to the hazard type you may be encountering. Treat the gloves if they are always contaminated. Carefully don and doff the gloves with that in mind that they are contaminated, as to not to contaminate your face by way of touching while using the gloves, and not contaminating your hands when donning and doffing the gloves. Concentrated hand soap. There are bottles of concentrated hand soap that have been made available at the warehouse since April 1st. If you've not received one of these bottles yet, please contact your project manager immediately. There is a bulk refill supply available now at the warehouse to completely refill the dispensing bottles. This is a concentrated hand soap and only a small amount is needed to properly wash your hands. Carefully unscrew the cap off and then cup seal the open top with your palm. Tip the bottle to allow a few drops of the soap to coat your palm. Upright the bottle and then use this concentrated soap with water with the CDC recommended hand washing cleaning procedure. So you're going to wash your hands frequently with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing, or again when donning and doffing PPE. So you want to wet your hands, soap up, scrub for 20 seconds, palms, fingers, and in between the fingers, top and bottom, around your wrists. Rinse well under running water, dry your hands, and use your towel to turn off the water. That way you're not reinfecting yourself. In the absence of soap and water, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Cover all surfaces of your hands and rub them together until they feel dry. So you're applying it, amount of on your palms. Rub the hands together, covering all surfaces, including the backs of the hands. Do not use water. Rub the fingertips on each in the palm and the opposite palm, and rub until hands are dry. Paper towels are not needed. We have hand sanitizer made available at the warehouse. The bottles are available to be distributed to the field employees by way of the project managers. Please contact your project manager if you do not have one of these, and please use according to the directions. Equipment sanitizer, antiviral surface cleaning solution in spray bottles is now available at the warehouse. Project managers, please be sure there is one of these bottles with Virex at each job site. Please follow the use instructions on the bottles, and they can also be found on this link here. There's also information on the Virex right on our KHA SDS electronic safety data sheet app. Clean and disinfect frequently touched objects and surfaces, including tools, handles, handrails, PPE, and other equipment, according to the directions. Thank you for your attention to this safety update. Please let your project managers and safety director know if you have any questions, comments, or concerns. Thank you, and be safe.